walking through Baltimore life, the drug life, the monkey dust and all of that stuff.
With Baltimore, man, where dreams come true and dreams can be lost. It's up to you and the people you be around.
Ohio, often called the heart of it all, brings to mind bustling industry, strong communities, and the enduring promise of the American dream. Yet behind this proud identity lies a painful contradiction. Countless men and women walking the streets, homeless and overlooked. How can a place known for opportunity stand by silently as so many live without a home? And why do these faces remain unseen amid the rush of thriving cities? Here, we confront the reality of homelessness in Ohio, moving beyond the statistics to uncover the raw human stories of struggle, resilience, and hope. What drives this crisis in the very shadow of prosperity? And more importantly, what will it take to restore dignity and security to those left behind? The answers are waiting if we are willing to truly see.
Ohio's homeless, up 12% to 17,000. Columbus hit 6,000. We're out here, forgotten.
According to the 2023 point-in-time report from the Ohio Housing Finance Agency, nearly 17,000 people were experiencing homelessness across the state at the start of 2023. That's a 12% jump from the previous year's figure of about 15,200. The trend mirrors national data from the U.S. Department of Housing and Urban Development, which reported a 3% increase in homelessness nationwide during the same period. In Ohio, Columbus alone accounted for more than 6,000 homeless individuals, the highest number recorded in more than a decade. Meanwhile, Cleveland, Cincinnati, and Toledo all reported spikes in unsheltered homelessness, with increases ranging from 10% to 15%, according to local shelter coalitions. Yet these official numbers only scratch the surface. Experts at the National Alliance to End Homelessness warn that the true figure could be 30 to 50% higher when factoring in people who are couch surfing, living in cars, or avoiding formal outreach. This hidden population is especially common in Ohio's rural and suburban counties, where homelessness is less visible but just as urgent. The statewide rise in homelessness underscores its complex, interconnected causes. Housing costs are climbing faster than wages. In Columbus, median rents were projected to rise by 8% between 2022 and 2023, even as the state's minimum wage remained flat. Economic disparities, including deep-rooted racial inequities that hit Black and Indigenous communities hardest, add to the strain. At the same time, overstretched shelters and social services leave too many without access to mental health care, addiction treatment, or stable, affordable housing. This crisis reaches far beyond individual hardship. It threatens community, stability, and social cohesion. As housing costs climb and the social safety net weakens, more Ohioans are at risk of slipping into homelessness. The urgency for comprehensive, coordinated policies has never been greater. But how effective are today's government and nonprofit programs in meeting this challenge? Initiatives like Ohio's Housing First program and HUD's Emergency Solutions grants have helped many secure stable housing. Still, gaps in access, funding, and long-term support remain. How can policymakers close these gaps before the crisis deepens? And just as importantly, what role do local communities and everyday citizens play in this fight? Looking at these questions from multiple perspectives is vital to creating solutions that last. As homelessness worsens across Ohio, public policy and social safety nets are coming under greater scrutiny. Understanding how state and federal programs do, or do not meet the needs of those without housing is essential. From emergency shelter and rental aid to mental health care and job support, a web of programs exists, but their reach and effectiveness vary widely. In the next section, we'll take a closer look at Ohio's social protection systems and policies to combat homelessness, examining both their achievements and their shortcomings. How well are the most vulnerable protected, and where do the gaps remain? This analysis reveals the systemic challenges that fuel homelessness and underscores the urgent need for coordinated, compassionate action.
Housing First helps, but it's underfunded. Rents jump 20%. Camping bans push us nowhere.
Ohio has introduced several key policy initiatives aimed at reducing homelessness and strengthening support for its most vulnerable residents. At the center of these efforts is the expansion of the Housing First model, which focuses on providing stable housing first before tackling issues like substance abuse or mental health challenges. Research, including a 2022 report from the National Alliance to End Homelessness, shows that Housing First can cut chronic homelessness by as much as 50%. Yet in Ohio, limited funding has kept progress uneven. By mid-2023, only about 40% of eligible individuals had access to such services, according to the Ohio Housing Finance Agency. In 2023, the state boosted its Social Security spending on affordable housing and emergency shelters by nearly 20%, signaling stronger commitment in the face of rising need. Still, these gains are overshadowed by the steep rise in housing costs. Cities like Columbus and Cincinnati saw rents climb 15 to 20% in just 1 year, while wages lag behind inflation by nearly 4%, according to the U.S. Bureau of Labor Statistics. The end of federal pandemic-era rental assistance in late 2022 has made matters worse, stripping away a key safety net and leaving thousands at risk of eviction and homelessness. The Ohio Coalition for the Homeless warns. At the same time, new laws in cities like Columbus and Cincinnati have banned public camping in parks and on sidewalks, framed as measures to protect public safety and order. Yet advocates argue these laws effectively criminalize homelessness without offering real alternatives, forcing people into more hidden and dangerous living conditions. Reports from the ACLU of Ohio point out that such policies often mask homelessness instead of addressing it, raising both ethical and practical concerns. This complicated policy landscape highlights a fundamental tension, the balance between maintaining public order and providing meaningful, compassionate support to people in crisis. Ohio's social safety net, though strained, remains essential. Its effectiveness depends on steady funding, stronger coordination among agencies, and policies that tackle root causes instead of just symptoms. So the questions remain. Who are the most vulnerable groups caught in this web, and how can policies adapt to better serve them? Answering these questions is crucial to understanding both the limits and the possibilities of Ohio's homelessness response.
Old folks, single moms, LGBTQ kids, vets like me, homeless. Opioids trap us, help's scarce.
The demographics of homelessness in Ohio reveal deep and troubling disparities that demand close attention. According to the Ohio Housing Finance Agency's 2023 report, older adults, those 62 and older, now make up nearly 18% of the state's homeless population. This group is especially vulnerable as fixed incomes fall short of rising costs. Healthcare expenses are climbing an estimated 5% each year, while housing costs continue to surge, with median rents rising more than 15% in major cities like Columbus and Cleveland, according to the U.S. Bureau of Labor Statistics 2023. Families with young children, particularly single mothers, represent another growing share of Ohio's homeless population. A 2023 study from the National Center on Family Homelessness found that these families account for roughly 25% of cases statewide. The challenges they face, balancing childcare, unstable employment, and limited shelter space, create constant instability. Survivors of domestic violence are also at high risk. Data from the Ohio Domestic Violence Network shows that nearly 30% of emergency shelter residents are escaping unsafe environments, often with no safe or affordable housing options, leaving them vulnerable to repeated cycles of homelessness. The LGBTQ+ community faces disproportionately high rates of housing insecurity, driven by family rejection, discrimination, and systemic barriers. A 2022 survey by the Williams Institute estimated that LGBTQ+ youth make up 40% of Ohio's homeless youth population, far higher than their estimated 5% share of the general population. Discrimination in shelters and housing services compounds their struggle, shutting them out of critical pathways to stability. Veterans, too, remain a significant part of Ohio's homeless population. A 2023 report from the U.S. Department of Veterans Affairs found that veterans account for about 8% of the state's total. Many live with the dual burdens of post-traumatic stress disorder and substance use disorders, which deepen housing instability and complicate access to support services. Ohio's devastating opioid epidemic deepens these vulnerabilities. The Ohio Department of Health reported nearly 4,000 overdose deaths in 2023, many of them among people who were homeless or living in unstable housing. Substance use disorders are tightly intertwined with mental health struggles, forming a cycle that makes it even harder to find and keep stable housing. Research from the National Institute on Drug Abuse shows that untreated addiction combined with co-occurring mental health disorders greatly increases the risk of chronic homelessness. Recognizing these overlapping challenges is critical to designing targeted, compassionate interventions. Homelessness is not one problem with a simple solution. It is a complex mosaic of social inequality, economic hardship, health crises, and systemic discrimination. Tackling it requires moving away from punitive measures toward comprehensive strategies that prioritize dignity, support, and long-term stability. So what root causes most powerfully drive this crisis? Systemic racism, inadequate mental health care, or the crushing cost of housing? And how can policymakers, communities, and everyday citizens come together to craft solutions that reflect this complexity? These questions sit at the very heart of Ohio's and America's ongoing fight to end homelessness.
Rent's up 20%, wages flat. Opioids kill, mental health care's gone. We're trapped.
Homelessness in Ohio is driven by a web of economic, social, and health-related pressures. At the center of the crisis is the sharp rise in housing costs. Data from the U.S. Census Bureau's American Community Survey shows that median rents in major metro areas like Columbus, Cleveland, and Cincinnati jumped 15 to 20% between 2021 and 2023. At the same time, median household incomes have remained flat or even declined slightly when adjusted for inflation, according to the Bureau of Labor Statistics. This widening gap leaves thousands of families just one missed paycheck away from eviction. The Joint Center for Housing Studies at Harvard University estimates that more than 40% of Ohio renters are cost-burdened, spending over 30% of their income on housing, while nearly 20% spend more than half. The end of federal and state emergency rental assistance programs in late 2022 removed a crucial safety net. The National Low Income Housing Coalition, reports that eviction filings jumped as much as 25% in some Ohio counties during early 2023, directly fueling the rise in homelessness. In Franklin County, home to Columbus, evictions surged 30% in just the first quarter of 2023. The sudden loss of rental aid exposed deep flaws in housing stability and hit low-income and minority households, the hardest groups that already make up a disproportionate share of Ohio's homeless population. Health-related struggles are adding even more weight to Ohio's homelessness crisis. The state's opioid epidemic, among the worst in the nation, has torn through families and communities. In 2023, the Ohio Department of Health recorded nearly 4,000 overdose deaths, many involving people already living with unstable housing. Addiction both drives and results from homelessness, creating a vicious cycle that is nearly impossible to break without proper intervention. At the same time, a severe shortage of mental health services, highlighted in a 2023 report from Ohio Mental Health and Addiction Services, leaves thousands without the care they need to maintain stability. The Substance Abuse and Mental Health Services Administration estimates that nearly 60% of people experiencing homelessness live with some form of mental illness, making the path to permanent housing even more complicated. Political battles over budgets and priorities often stall or water down investments in programs that could make a difference. While Ohio has increased affordable housing funding by 20% as of 2023, experts from the Ohio Policy Institute warn that this still falls far short of the actual need. Waiting lists for subsidized housing stretch for years in many counties, and key initiatives like Housing First remain underfunded and fragmented, limiting their effectiveness. These overlapping problems, rising housing costs, addiction, mental illness, and systemic underinvestment, are deeply interconnected. Piecemeal solutions cannot solve them. What's needed is a coordinated strategy that brings together government agencies, nonprofits, health providers, and communities to address housing affordability, expand healthcare access, and reduce economic inequality all at once. Without that, the cycle of homelessness will only persist and likely grow worse. The pressing question remains: what role should government and society play in building sustainable, humane solutions to this complex crisis? How can we reimagine policies that not only prevent homelessness, but also create real pathways to recovery and stability? These are the challenges Ohio and America as a whole must confront head-on if we are to change the course of this growing social emergency.
More shelters, mobile aid, good start. But bans push us out. Housing's still scarce.
Ohio, working with local agencies and nonprofit partners, has made notable progress in addressing homelessness. According to the Ohio Housing Finance Agency, the state expanded housing capacity by about 15% in 2023, providing emergency shelter to thousands of individuals and families. Funding for mobile outreach programs has also grown, enabling organizations to deliver free meals, basic medical care, and hygiene services directly to people living unsheltered. Another positive step has been the integration of mental health and addiction recovery services with housing initiatives, reflecting a growing recognition of the complex challenges faced by homeless individuals, according to the Ohio Department of Mental Health and Addiction Services 2023. Still, these achievements only touch the surface of a much larger crisis. The criminalization of homeless encampments through public camping bans in cities like Columbus and Cincinnati has become a harsh reality. These laws often sweep people out of visible public spaces without offering safe alternatives, pushing already vulnerable populations into greater invisibility and danger. Reports from the American Civil Liberties Union and local advocacy groups condemn these policies as punitive and counterproductive, arguing they intensify trauma rather than provide solution. Shelters, even with added beds, remain full to overflowing. Data from the Ohio Coalition for the Homeless shows that many operate at 95–100% capacity year-round, leaving no cushion during cold weather or emergencies. Affordable housing is also in critically short supply. The National Low-Income Housing Coalition's 2023 Out of Reach report ranked Ohio among the states with the widest gap between available affordable units and the number of low-income renters. In many communities, waiting lists for subsidized housing stretch for years, trapping families in a cycle of instability. Perhaps most troubling is the fragmentation and lack of coordination among services. Without a unified statewide strategy that prioritizes housing-first principles, robust social supports, and comprehensive health care, including mental health and addiction treatment, responses remain scattered and reactive. The Ohio Policy Institute has criticized current policies as inadequate and fragmented, calling for bold reform rather than small, incremental changes. In short, while Ohio deserves credit for expanding emergency assistance and acknowledging the complexity of homelessness, the absence of coherent, well-funded, and humane policies has left thousands still struggling. The question remains, what comprehensive path can deliver lasting solutions, restore dignity, and truly end homelessness, not just push it out of sight? Without decisive action and accountability, the crisis will not improve. It will only deepen. Ending homelessness in Ohio calls for a unified, systemic response, one that recognizes this crisis is not the failure of individuals, but of social structures and public policy. The National Low-Income Housing Coalition's 2023 report shows Ohio faces a shortage of more than 160,000 affordable housing units for extremely low-income renters, underscoring the urgent need to expand housing development. Just as critical is strengthening social safety net programs and increasing investment in mental health and addiction recovery. The Ohio Department of Mental Health and Addiction Services reports that nearly 60% of people experiencing homelessness live with behavioral health challenges that directly affect their ability to secure and maintain housing. Communities across Ohio also have an essential role to play. Volunteer programs like those run by the Central Ohio Coalition for the Homeless feed thousands each week, offering not only meals but also human connection and dignity. Advocacy groups are pushing for reforms such as stronger funding for Housing First initiatives and tougher protections against evictions. At the same time, public awareness campaigns are working to break down stigma, reminding society that homelessness is about people, not statistics. The documentary asks audiences to think deeply about personal responsibility. How can awareness turn into real action? What practical steps can each of us take, whether through volunteering, advocacy, or simply showing respect, to help those in need find stability and hope? Together, with empathy, long-term commitment, and coordinated effort from government, nonprofits, and citizens, Ohio can face homelessness head-on. This path forward is about more than solutions. It is about restoring the dignity and humanity of those who've been left behind for far too long. Conclusion. Homelessness in Ohio is a growing crisis that reflects the deeper social inequities facing the United States. While programs like Housing First and increases in welfare funding show promise, far more remains to be done. Rising drug addiction, untreated mental health struggles, and the crushing cost of housing combine to create a perfect storm that forces more people onto the streets. If left unaddressed, homelessness threatens not only individual lives, but also the strength of our communities and the well-being of society as a whole. The responsibility to act belongs to all of us, to advocate, to serve, and to step forward. As we close this discussion, ask yourself, how will you contribute to ending homelessness? And what must we, as a society, do to ensure that everyone has a safe and stable place to call home?